When we hear about community engagement in health, we often hear how communities are giving feedback on their health facilities and the health services that they receive. In many countries, we also hear how communities are helping to spread health promotion messages. But what if we could empower the community to do more? Imagine if you and members of your neighbourhood could have real influence on the decisions that affect your health services and how they are managed. In Senegal, Abt Associates is working to do just that. Let me take a step back and explain why this topic is important. Research has shown that strengthening and scaling up the role of the community could avoid over 2 million maternal, newborn, and child deaths every year. During pandemics such as COVID, the community is already on the front line and is ideally placed to identify gaps or challenges in health services in real time and help identify solutions. Yet, at a recent global symposium on health systems research, the community level was described as the invisible level of the health system. This is because efforts to strengthen the health system often ignore the role that communities can play in increasing the accountability of the health system to the populations that they serve. How then can we go beyond having community members passively participate in discussions about their health facilities to actively helping to govern the health services that are meant for them? On the Health System Strengthening Plus project in Senegal, Abt Associates and its partners are helping residents to be more involved in these decisions. We've helped set up over 400 health development committees. Each community serves one health centre. They include members from the health sector, civil society organisations, elected officials, and local government authorities. These local committees have three goals. They help to decide how resources are allocated to the health facilities, how to raise additional money for new staff or equipment, and they monitor how resources are spent. USAID in Senegal considers these health development committees to be an important health investment. One of their recent evaluations said that the committees have helped to solve important problems that hindered the operation or functionality of health structures. The committees that Abt Associates has helped to support have been so successful that a national rollout has been included in the Ministry of Health's National Plan for Community Healthcare. I want to share some examples of how these committees have come together to solve their own health problems and why they make such a difference. Just outside the capital city of Dakar, 2 health committees worked with their local health district and the mayor's office to find new funds to establish a new surgical operating room and new facilities for obstetric care at their local health centres. The funds they've raised have enabled them to recruit 2 gynecologists and 2 anaesthetists and have established a 24-hour reception. They've repaired the ambulance for their district so it's functional again, and they've also been able to upgrade all their lab equipment. As you can imagine, these improvements to the health facilities will mean vital new services for the local community that were not available before. And this is all thanks to the influence and credibility of the health development committees and to the active participation of their volunteers. In Senegal, we've seen that engaging the community to identify and implement health solutions, not just to give feedback, has resulted in more money for local health centres, critical new equipment, and the hiring of urgently needed key health workers. All this is contributing to improving maternal and child health and reproductive health services. Between 2016 and 2018, the rate of births assisted by a medical professional increased by 10% in the region of Dakar. The rate of fully vaccinated children increased by 7%, and the number of women using a method of contraception increased by 46%. Health happens in the community, so the solutions must also start there. And during a global pandemic, communities experience the challenges with their health system more acutely. So we must trust and empower the communities to play a bigger role in strengthening the health system. Because in the end, if the community can help make key decisions about their health services, it will ensure that the health system is less reliant on external actors and is more responsive to their own needs. Thank you.